December is Pancreatic Cancer Awareness Month, and here to tell us more about the signs, the symptoms, and the latest treatment options, we have Dr. Chanel Bagwinden, the medical director of the Gastrointestinal Surgical Oncology Program at the Jupiter Medical Center. Good to see you again. Thanks for coming back with us.
Thank you for having me.
So first, we are aware of what pancreatic cancer is, of course, but just how common is it?
Yeah, pancreas cancer is the third most common cancer that we see and treat. It's on track to become the second most deadliest cancer. It makes up about 3% of all cancers that we see. And what that equates to is about 65,000 new cancer diagnoses typically within 2023. Not to ring the alarm, but where we're concerned about is that we're seeing a rise in that diagnosis, and particularly the deaths, where about 50,000 people are dying from that cancer every year. So there is enough of a awareness that needs to be made with this diagnosis and how best we can effectively treat it.
Yeah, and speaking of treatment, the last time you were here, you told us about some exciting research going on that was pretty promising. Are there any updates on that?
Yeah, absolutely. So that was a phase 1 clinical study with a vaccine trial, specifically an mRNA vaccine that looked at the safety of the vaccine, but also to see if patients didn't have recurrence or relapse of their disease in a short period of time. Since August, that has gone into a phase 2 study, which basically is applying 2 arms to that study to now look and see, particularly with that vaccine, the standard of care being surgery followed by chemotherapy with an early pancreas diagnosis, but now looking at utilizing that vaccine with a checkpoint inhibitor, which is immunotherapy, as well as chemotherapy after surgery. And it'll compare about 260 patients in that group and see, in fact, can the body essentially use our immune system to keep that cancer at bay?
Oh, that's awesome. So we know things like that do take quite a bit of time, though. So in the meantime, while we wait for approval for a vaccine like that, what's notable about your approach to treatment?
Yeah, I think with anyone with this diagnosis, they need the appropriate expertise. Jupiter Medical Center is a center of excellence for pancreatic cancer within the state of Florida. And you really need a multidisciplinary approach, which is a team of experts that treat and diagnose this deadly disease. And I think within our pancreatic cancer community, we are, for the first time in a long time, becoming more optimistic about available treatment options. So I think being at a center of excellence that treats this disease, has the available expertise to have the discussions, review pathology, imaging, things like that, it really does take a multidisciplinary team to make sure that people are getting a personalized treatment approach every time.
All right, Dr. Bagwinden, thank you so much for being here.
Me.
We really appreciate it.